Yeah, I think there's a big knowledge gap in AI in general for the public who does not work on AI. Obviously, there are people who've dedicated their careers to being at the forefront of developing novel AI models, and AI models are beginning to start training the next AI model. And so the human expertise in that field is there, but most oncologists are not well versed in that. And they've kind of played with ChatGPT, or they use it to help summarize a paper, but they don't really have full knowledge of all of the tools that it could use in clinical trials as well as in drug development. And I would specifically hope that we start to see this being used in what we call decentralized clinical trials, meaning that you could open a study theoretically at hundreds of sites, and instead of having a research nurse or a data coordinator or the infrastructure that we typically think is required for clinical trials to be at each of those sites, you could have an AI tool embedded in a medical record system that effectively acts as the clinical trial staff and reminds the physician to order the lab on this date, that collects the data, that calls the patient to remind them to do various things. I think that the field is going to need to evolve quite rapidly, and so physicians will need to learn about how these tools can be not just a chatbot, but something that actually influences how we practice medicine.